Jack, you have 15 minutes to complete this skill sheet. Do you have any questions? Are you ready?
Yep.
Okay, you are dispatched to a private residence for a possible stroke.
Okay. So walk in. BSI is my scene safe.
Yep.
It's my only patient.
Yes, sir.
Okay. The nature of this illness seems to be altered mental status. We'll dive into that more. I'll consider additional resources after further evaluation, and I'll consider ceasefire precautions.
All right. You find the patient. He's sitting on the sofa. He's alert when you walk in.
Okay. So I'll walk in. I'd introduce myself, form a general impression of the patient. Is there anything that I see glaring in my impression?
No.
Okay.
He's having a hard time finding the words.
Good. So I'm assess his level of responsiveness.
He's alert.
Okay, I kind of confirm the chief complaint. Is there any immediate life threats?
Wife says that she thinks he's having a stroke, and you don't see any life threats.
Okay. Based off of a concern of stroke and difficulty even with speech, I'm going to consider rapid transport for this person. And from there, I'm going to move into my assessment of them. I'm going to go through the airway there, the ABCs, making sure they're able to communicate, just not the right words. So it sounds like airways patent, able to protect it. I will consider oxygen if needed. Probably be high flow oxygen. And then just their general breathing, like rate, depth.
He is normal depth, bilateral at 16 a minute.
Okay. I'm going to assess circulation, just skin color, how
Pink, warm, and dry.
pink, warm, dry. Cap refill. Is there any bleeding around them?
Nope, no major bleeding. Cap refill is good.
Okay. So after I do that, I go through my ABCs. I'm going to get into my history taking. I'm going to go through my sample of PQRST, signs and symptoms. He's got
Altered mental status and difficulty speaking.
okay, allergies,
No drug allergies.
medications.
Takes a high blood pressure medication. Wife doesn't remember the name.
Okay, past pertinent medical history.
High blood pressure.
Okay,
And a cardiac event 10 years ago.
okay. So no history of stroke or anything like this before though.
No. And I heard you say last oral intake was breakfast.
Okay. And then we'll dive into OPQRST, about how long ago did this start, when he was last seen normal.
Last seen normal was at 4:15, so it's been about an hour.
Okay. Provocation doesn't necessarily make sense here. Anything make it better or worse? I mean, like positioning, no complaints of head pain or anything like that.
Nope.
So then, I could assess quality and if it radiates, I guess, a little bit. It's hard to tell there.
He's a little dizzy.
Okay, and the time. I'm sorry, would you say, how long has this been going on?
1 hour.
1 hour? Okay. So after doing that, I'm going to move forward into getting my vitals on him. We need full workup, blood pressure, blood sugar, just because he's altered, pulse ox reading on him, oxygen saturation,
Okay.
all the goods.
Blood glucose is 100.
Okay.
SpO2 is 94% room air. Pulse is 90 and regular. Blood pressure is 130/95.
Yep.
Respiratory rate is 16, like I stated, and you're moving good air.
Okay, so with that, I'm run through a quick stroke scale using Cincinnati, looking for arm drip, equal bilateral grip strength, if they're able to move their feet up and down there appropriately, if there's deficits from one side to the other, pupils, and then speech, which we already have deficits in there. So
you notice also slurred speech.
Slurred speech.
But everything else is unremarkable.
Okay. So that's enough on the checklist for me. I'm gonna call stroke activation. We're gonna get 2 large IVs started on him. Probably withhold fluids at the time unless anything were to change. and then begin a transport. My field impression is that it's a stroke, and so taking him to the appropriate facility, going to reassess, constantly monitoring. It's a critical patient, so every 5 minutes, checking vitals, and just overall patient condition, any change of mental status or responsiveness. And
Nothing like that. He's stable
Good.
for your transport. You have the choice of 2 facilities.
Okay.
They're the closest. The closest one is 10 minutes, and it's a community access hospital with imaging.
Okay.
And then 50 minutes away is the region's stroke center.
Set 50 minutes.
Yeah, 50.
Okay, so I mean, if we're within an hour of the origin or last seen normal here, I would probably like to go to the stroke center.
Stroke center.
Keep us under the time limit there, and that 3 hour mark still be working good.
All right. Is there anything else you'd like to add?
No.
Nice job.